Well, thanks so much, everybody. Kate and Jackie for helping put this brown bag learning series together for the Texas Autism Society. My name's Lynn Cowles. I am a professional in the Austin area working with families to support their loved ones who have special needs, adult children and youth children too. And the Autism Society has put together this brown bag series to help share information with community members during the COVID crisis and before and after that too, just to make sure that community members, family members, friends, family who share lives and stories with people with special needs have thorough knowledges of what kinds of things are important to the community and also how people can keep the community maintaining good relations and also healthy relations together. So what I'm going to be talking about today are respite and support services for friends and family members who have loved ones with special needs in technically in Texas in general, but we're going to focus a lot on organizations in the Central Texas area. So I am going to share my contact info here at the bottom of the screen, just so everyone has it. I'll share it again at the end too. If anybody has any questions while watching this presentation, if you're watching on Facebook, you can use the Facebook chat if you'd like to ask questions or share experiences or just give feedback in general. And if you'd like to do any of that also, if you are participating in the Zoom conversation, then you can use the Zoom chat function too. And Jackie on the back end is going to collect those questions. And there is a Q&A session also at the end of this presentation. So if anybody wants any questions answered directly, then we'll get to those at the end too. And we've got a little break in the middle also, just because there's lots of acronyms and lots of information here. I'm just going to tell everyone a little bit of info about me first. I'm from Richmond, Virginia. I grew up there. And when I was 17 years old, I had my older brother was in a car accident and suffered a spinal cord injury. And when that happened, the life of myself and my family changed pretty drastically. And I became accustomed to working with big institutions like hospitals and Medicaid and attendant agencies and such, and making sure that our family was organized in its response to that family tragedy, to that difficulty. And so I kind of learned when I was very young how to organize information and make sure that lines of communication are clear between big offices and institutions and the individuals who are working within them to stay healthy. And so when I moved to Texas in 2008 for graduate school, I was at UT and I was in the English department, and I realized how much I kind of missed doing that work. And so I ended up working with a couple of families in Austin to make sure that they kind of like knew how to either access a Medicaid waiver or how to use a Medicaid waiver to its best extent. And we'll talk about what a Medicaid waiver is here in a little bit. And so when I finished grad school, I had a PhD in English literature. So I did a lot of research for that degree too. And that research has become really important to me as I've been working with families in Central Texas to help make sure that they know how to use the resources that are available to them as their loved ones with special needs make changes in their life and get older and have amazing successes together. So I have been managing healthcare networks for about 19 years now. And I am certified as a support advisor through the Texas Health and Human Services. And we'll get into a little bit what a support advisor does in this presentation. And then I am also certified as an application counselor through the Center for Medicare and Medicaid Services. So what that means is that I can help people make informed decisions about their healthcare through the public marketplace or through state and federal programs like Medicaid or CHIP. And I also host the Texas Autism Society's South Austin Support Meeting, which is every second Wednesday of the month, virtual now, of course. But that's a lot of fun too, just to meet community members and share with them. I'm also a writer, community organizer. I work with the Austin Justice Coalition and with ATX camp support right now to make sure that community members who are vulnerable have full sets of resources that they can use to maintain health in this time also. And I also play soccer, so I rip midfielder there. So the topic, like I mentioned, of this Brown Bag Lunch Series conversation today is respite and support services. These are the kind of high points that we're going to hit. The first of which is that support services for loved ones or family members or friends with special needs is always effective, or always more effective, when it is a collaborative community effort. So when people feel comfortable reaching out to their neighbors and their friends and their families, and have full confidence getting on the phone and talking to somebody at Health and Human Services even, or Integral Care, or any of the organizations that are important in our family members' lives. Those are the moments when personal care networks are really effective. So when people have access to the resources that they need for them and their family members to be healthy, even given some kind of intellectual or developmental atypical condition. And the playing field, I just wrote that because we're going to go through a few acronyms just to talk about the major structures that influence the lives of people with special needs. We'll also talk about tools for success. I will review very briefly Medicaid waivers that are available to folks in Central Texas. Those include waiver systems like CLASS or home and community-based services. And then we'll talk specifically about some respite options also here in a bit, and caregiver support services. And those are going to be different resources, not for people who have special needs, but for their loved ones or friends or family or staff who look after them. And then I've got a couple of announcements at the end here, and then we'll switch over to Q&A. So I'm just gonna switch my screen here, and I'm gonna emphasize this this two-part kind of like main takeaway here that I want everyone to leave this Brown Bag Lunch Series with. And that is, if you live or support a person who has a special need or a set of special needs, the first thing to do to make sure that that person's life is as stable as possible is to organize your network, and don't be afraid to reach out to people. So when I say organize your network, that is what I mean when I said earlier that there are all kinds of different groups of people who can be influential in the care of a person with special needs. That's, the doctors, therapists, coaches, right? Whether it's some like a coach at a team sport, or teachers, the people who are directly involved in people's care on a daily basis, moms and dads, obviously, brothers, sisters. But I also, when I say network, I mean to broaden that sense also to include community organizations, neighbors, maybe partners in a business, right? People who even contextually in a family might work very closely with family members and know about the specifics of their lives. Those are the people who can also be really helpful during times of crisis, when offices that are traditionally open to people can't be open anymore, or when organizations that generally have enough funding to spread around to folks maybe don't have that funding left anymore because everyone's reaching out to it because of a crisis like the COVID crisis. So the best time to organize a network is to do it before a crisis hits, of course. And we'll talk about some different ways of doing that. And shout out to Texas Parent to Parent too, who does a really good job helping people organize networks of care so that people are prepared when crises hit. And then sometimes you can't, sometimes you're not able to make sure that all the ducks are in a row, or that all the offices have been called before something happens like a pandemic. I know that we are in like an unprecedented time right now, but this is not the last time that we will experience a crisis together or as a special needs community. And so when that happens, we cannot be hesitant about reaching out to one another. That is a really, really important stage for maintaining stability during a crisis. So I think what I tell a lot of people is just get on the phone, you know, during business hours, after business hours. If there's somebody who has a, you know, even like a funny joke or a wise word that can help people maintain good feelings and good relationships with their friends and family during this time, they absolutely should. But I also mean reach out in the kind of more programmatic senses too, in terms of reach out to the offices that are responsible for medical care, reach out to therapist offices to see what kinds of teletherapy options they have right now. All of these things, all of these strategies serve as ways that family members can create breaks for themselves if they are family caregivers, and then also continue the diverse interactions that our loved ones with special needs have with their broader community. So organize and reach out, and I'll say that a bunch of times. All right, so here's where we're going to talk about some distinctions that can be really important as people wade through the kind of the very complex waters of living with special needs and also of helping people with special needs succeed. We've got home care versus home health. Home care is a broader set of practices and services that individuals or agencies will provide for people who have special needs. So that's like home care includes things like light meal preparation, getting dressed, right? Managing medications like refills and such, even doing light housework. Those are kind of like the broad living circumstances that that family caregivers or professional caregivers or friends and family caregivers can give to people who have special needs. Home health is more specific. Home health does require a directive from a doctor, and it is generally for people who are transitioning back into the home after they've had some kind of major procedure like a surgery or some kind of other extended stay in an hospital or another kind of care facility. And so a lot of what we'll be talking about here today is home care, because family caregivers and professional caregivers and other friends and family members who help support are often involved in that less specific, less medically driven home care that is a little bit more informal around the house and can include things like social time, music therapy, for instance. And we'll talk about the Social Security Administration just a little bit. I promise I won't get too much into it in this Brown Bag Lunch series, because it is the Social Security Administration that is the home for the law that allows people with special needs to waive their rights to institutional funding so that then they can use that funding to live a life in their community. And so it's the Social Security Administration that provides the policy infrastructure for the Medicaid waiver system that often allows people with pretty severe intellectual or developmental disabilities to live in their homes, to get home care, to get home care or home health if they need it, but to get home care from community members or from professionals. The local intellectual and developmental disability authority is the authority that allows individuals with special needs to invest themselves or to use a Medicaid waiver. And we'll talk, like I mentioned, we'll talk about those a little bit down the road, but the local intellectual and developmental disability authority, LIDA for short. I'll try not to use too many acronyms too. I really don't like acronyms. But in Travis County, that's Integral Care. Integral Care is the organization that will serve as this case manager or service coordinator for people's Medicaid waivers. And there are many different LIDAs across the state of Texas. So if anybody ends up watching this presentation and they're interested in getting services through the Medicaid waiver program for a loved one with IDD, with intellectual and developmental disabilities, then they can find on the Health and Human Services website the local intellectual developmental disability authority in their area, and that's who they would go to start the application for a Medicaid waiver process. And that would be to get that funding from the Social Security Administration that would allow somebody to access lots of services in their community so that they could remain in their community rather than being in a state-supported living center. And I use the acronyms anyways. HCS is an acronym for Home and Community-Based Services. CLASS is another waiver. I don't actually know the acronym for that one. Texas Home Living and STAR Plus. Those are all different Medicaid programs in the state of Texas. And we unfortunately, or fortunately, don't have enough time to get into all the details of them right now. But I am going to go over them briefly, and I just put them here because I want people to know that there are many, many different Medicaid programs available to them, depending on their level of need, their income, and also their location. This next one here, CDS is Consumer Direct Services, and Consumer Direct Services is a service delivery option that is available to families who opt for it if they get certain kinds of Medicaid waivers. And what that does is it allows an individual family to take the Medicaid waiver funding that they have from that Social Security Administration pool and work to dole it out on their own rather than get an agency, a class agency or an HCS agency to monitor that funding for them. And what that does is it gives families the ability to find and train and hire their own personal home care attendants. And so that just gives some families a lot more independence in the people who work with their loved ones with special needs. Now, I do have to say, just as a caveat, that it is a lot of work for families to opt for consumer direct services. Finding home health care aides is not always an easy process. And the training that goes into developing and cultivating a person to work to fit the very special needs of your loved one can be kind of a long process, and it takes lots of meetings, and it takes lots of conversations and lots of hands-on training. And I'll say also that the CDS option, the Consumer Direct Services option, can be even more difficult during a crisis like COVID-19, and that's because when people have agency provider services, right? So if they have the exact same waiver as somebody who has opted for consumer direct services, they might go through an agency who would then staff their loved one's attendant care, whether it's out in the community or at home. And so when people choose the agency method instead of the consumer direct services method, then they have access to a pool of healthcare providers, right? So if somebody's sick or can't make it in that day, then the agency can usually just tap somebody else to fill those attendant hours for the Medicaid waiver recipient. But if somebody opts for CDS, the trade-off there, you get to train your own employees. They actually make a little bit more money, but then you also have less ability to find somebody to fill in if somebody has a life emergency or a sickness or something. So there's really pros and cons to each of these methods. And they are very specific to each family, which again, as I mentioned in the beginning, organizing a healthcare network and reaching out to communities from the nuclear community in a home to the friend group, to the work group, to the broader community groups like faith circles or advocacy circles, then those are the opportunities that people have to really organize their loved one's care network before there's a crisis. And the second acronym here is FMSA, and that stands for Financial Management Services Agency. And that is an agency that will pay employees who are hired through the Consumer Direct Services option. And I'll talk about when people have a chance to opt for those later on when we talk about Medicaid waivers. MCO is a managed care organization. Managed care organizations are healthcare companies, insurance companies, for instance, that offer managed care plans. So they offer health insurance plans specifically for people who have different kinds of Medicaid. So this is the Blue Cross Blue Shields in Texas, or the Superior Health Plans, or again, depending on where people are in the state, they have access to different managed care organizations for programs like the Children's Health Insurance Program, or for Star Plus if a child is on the Star Plus waiver. So those are important to people who have certain kinds of waivers, and I just want to introduce them here because they do have a big role to play in the networks that people have access to when they consider respite care and different support services. And right, a support, I put these two distinctions in here specifically because I am certified through Health and Human Services as a support advisor. So what that means is when families do opt for that consumer direct service option, so they want to hire their own staff and train their own attendants so that they know that their loved one is getting very particular care. Those families, when they opt for consumer direct services, and they can opt for that either right when they sign on to a waiver, or people can also change their service delivery option to consumer direct services anytime throughout the year. So if somebody does do that, if somebody opts for CDS or for consumer direct services, they can opt to also hire a support advisor through Health and Human Services or through an agency or one that they just find. But the Medicaid waiver, CLAS will do it, HCS will do it, I think Home Living will do it too, will pay for support advisor assistance to help hire, train, and maintain staff. So the attendance that people do find, and they can also manage communications within the network. They can plan network meetings. All of that falls within the purview of a support advisor, but that can only happen for 6 months in that Medicaid waiver. So the support advisor position is limited, but it does have a certification through the state of Texas. Support brokers are sometimes funded. Well, a support broker essentially does that same work, but they do it for the long term. In Texas, there's no funding available for support brokers right now. So people just have that 1 6-month option to hire a support advisor to help them with consumer direct services. In other states, support brokers can be funded for the long term, but we just can't do that in Texas yet. So you can still hire a support broker to help you, manage a personal care network, or organize a healthcare network, or manage communications with big offices, or even among network members. And those are, again, just the people who are important to a friend or family member who has special needs, who can assist then in decision-making and planning and organizing of that person's care. So that's what those two terms are. Right, and then we have providers and provider agencies, right? This is kind of connected to the distinction between consumer direct services and agency-driven services. If people do get Medicaid waivers, a provider can be a physical therapist, a provider can be a caregiver, a provider can be a music therapist or an art therapist. A provider agency, though, is an agency that will do the organizing of those tasks. And so there's lots of provider agencies in Texas, and especially in Central Texas. So as people figure out what funding sources they have, whether it's Medicaid or private insurance or a mix between those two things, they'll probably be dealing with a provider agency to help them manage that care, even if people do choose CDS. And then a provider versus a family caregiver. I think everybody who would be listening to this brown bag are very aware of what a family caregiver is. But I just need to make that distinction because there are some respite programs that will fund family caregivers, some that will only fund provider caregivers, right? People who are either out of the home or out of the home and also not a family member, or just out of the home. A family caregiver is a person who is, of course, related to the individual with special needs. And so just depending on what kind of funding source people are looking for respite or support services, some are specific to providers, some are specific to family caregivers. And then insurance is such a big topic, right? But usually the way that the Medicaid world works is if somebody does have access to like a health insurance plan, whether it's through their employer, whether it's through the public marketplace, or through a spouse, then Medicaid programs will require care for an individual to be funded through that health insurance policy before Medicaid will pick up the rest of the bill or the other bill. So Medicaid is what's called a payer of last resort, in that it will only fund, and even within certain restrictions, it will only fund services that the insurance company either maxes out or that they don't provide. So oftentimes when looking for respite care, it can be a good idea also to reach out, right? I'm going to say it again. Reach out to their health insurance company and see what kinds of options they have for respite care for individuals on the plan, and especially, if kids are on your plan too, then until those kids are 26, there might be respite options for them in there too. I'm just going to look at the time. Okay. I might need to speed up a little. Right. Okay. Tools for success as far as managing personal care networks and also finding respite sources for loved ones. I mentioned this before: organize, right? Plan, network, make sure you know who's invested in the well-being of your family, get to know your neighbors, make emergency plans, get on the phone. And I do, again, just want to say how important the Texas Parent-to-Parent Personal Network model is, because those folks really do have an extremely systematized and organized way for people to understand what kinds of people they have access to in terms of their collective decision making about their loved one with special needs. I'm going to talk a little bit about this in the announcement section at the end of this presentation, but there are federal resources available, or that people are talking about being available for people with special needs. The ARC of Texas right now has a substantial advocacy campaign going on to get people to call their representatives and advocate that programs for people with special needs are included in the next round of federal CARES funding in response to the COVID crisis. So I know that the federal government seems like really far away from people, especially when you're exhausted after having been working and also caregiving for 4 months. But I just want to mention that because if people have time, it is still helpful to contact your representatives and let them know that, first of all, what your life is like, and how they can help you, like how they can be assistive to you as you figure out what your family's needs are during this crisis. And I want to talk about some state resources too, right? As people's employment situations have changed, people become eligible for programs like SNAP, for food benefits, for temporary financial assistance. Both of these programs are available through yourtexasbenefits.com. And I am always going to tell people, like, even if you don't think you qualify, apply. If you have time, if you have a computer, if you have a person in your family who you can kind of pass that responsibility off onto, definitely go to Your Texas Benefits and apply for state programs and just get familiar with that process, because no one ever knows what's going to happen in the future. It's good to have a login. It's good to be prepared. It's good to organize before a crisis hits. And then there are also city resources in local areas. A lot of these ones that I'm talking about are specific to Austin, but if people have questions about local resources available to them throughout the state, my email address is at the front of this presentation. I'll put it in the chats also so that folks have it. But the Economic Development Office and the City of Austin's RISE funds right now are available to people who couldn't take advantage of of CARES funds, right? So people who are undocumented or people who otherwise didn't have income on paper to get stimulus checks. RISE funds are available for them. For business owners and people who are involved in nonprofits, there are economic development office programs right now available to folks too. And I'm mentioning these things not because they apply specifically to respite care, but because in the interest of maintaining a successful and organized family relationship, it's important for people to know what kinds of resources they do have access to outside of just the specific ones for their loved one with special needs. And then there's also community resources too, neighborhood associations, next door, mutual aid networks, which I'll talk about here in a little bit. All of these different organizations include folks who you can reach out to see maybe somebody has, free Wednesday afternoons, and maybe they're quarantining and they live just, 6 doors down from you. Or maybe you met somebody through a video chat or a webinar or something that's been, everybody's been webinaring recently. If there are people who you meet who are invested in the same issues that you're invested in, don't hesitate to reach out to them. Nextdoor is a great application for meeting neighbors. Neighborhood associations, of course, are too. And then last, nonprofit groups, right? The Capital Area Food Bank, Disability Rights Texas, Texas Parent to Parent, Foundation Communities. These are all organizations that have excellent resources available for keeping families stable during difficult times, and also for making sure that people know what their access to different healthcare models are. And since I also, full disclosure, I'm my certified application counselor certification through the Center for Medicare and Medicaid Services is through Foundation Communities. So I do know a lot about their financial programs that they have available for folks in Central Texas. So I'm just going to review those really quickly right now, just so that people know that they're out there. If anyone is having trouble applying for unemployment benefits or is looking to make a crisis budget, they can contact the financial wellness team. Tax help, the deadline just passed, but if anyone does need back taxes filed or needs to pay into the system quarterly to learn how to do that, the Foundation Communities Tax Help Program can help. The College Hub has been helping people with employment-related issues recently and also finding money to go back to school. And then the Health Coverage Program has been really beneficial for folks who have had changes in their income, because if somebody's income, a family's income does go down below 250% of the federal poverty line, then their kids may become newly eligible for the Children's Health Insurance Program. So, and this is, kids who are typical and kids who are atypical. So if there has been a significant change in your family's income, you don't have to keep paying for their health insurance if they qualify for the Children's Health Insurance Program instead. And last thing about these financial programs, they're all virtual right now and they're all completely free. So if you're, looking to save a little bit of extra money so that you can hire a respite care provider out of pocket or pay them privately, the financial wellness team might be somebody to talk to. Or if you think your child might be eligible for the Children's Health Insurance Program, then the health coverage team might be someone to talk to. So I just wanted to shout out those programs, which are free and operating just by the phone for the time being. Okay, so Medicaid waivers. I mentioned what they are earlier. We're going to do a brief review of some Medicaid waivers in Texas. And before we do that, though, I just want to, in a very general way, say that most Medicaid waivers do provide respite care for people with special needs, whether they are adults or children. In order to access Medicaid waiver funding, you've got to be on a wait list, usually for a very long time. The last time that I checked the HCS wait list, the Home and Community-Based Services wait list, it's about 12 years long. So one of my main tips to family members as I meet people in the community is, especially if they have loved ones with special needs, is to, no matter what age your child is, whether they are 21 years old and out of school or whether they are newly diagnosed at 4, is get on the Medicaid waiver list. Even if a child is like relatively high functioning, for lack of a better term, even if a child does present some of those capabilities when they're young, you don't know what's going to happen in the future. It's always a good idea to get on those Medicaid waiver lists. And like I mentioned, I'll go through a few of the prominent Medicaid waivers. And then say their name comes to the top of the list and they don't need it. That's okay. You can defer that spot on the top of that waiver list, and it can go to somebody else. It's just good to have the option for when times are either uncertain or when times are difficult, right now. It's always good to, like I mentioned, organize beforehand, prepare beforehand, and try to make sure that your loved ones have as many programs to choose from as are available. And then the Yes Waiver program I wanted to talk about specifically because it is not, it is a different kind of waiver program than like home and community-based services or CLAS or Texas HML. Those are waivers for people who have lifelong conditions or lifelong IDD, right? The Yes Waiver program is specifically for young people who have mental health issues. So it's not for IDD. It can be for somebody who has both IDD and mental health issues, but it's specifically for mental health issues, and they offer wraparound and reparative services. So that means that they have case managers who work with young people on a very thorough basis in order to like fix or solve a problem, right? So young people have to have IQs over 70, I think, to be in the Yes Waiver program. And also entrance into that program generally comes after a period of trying other things and those things not working. So whether it's like counseling or inpatient care or some other kind of strategy that a family was trying to use to help a person out of a difficult situation, if those things fail, then the Yes Waiver might be a good option for them. And right now, I'm gonna stop sharing my screen for a second, and then I'm gonna go back to it. I would like to go to my web browser so that we can check out some of these Texas Medicaid waivers. And I'm not going to spend very long doing this, and I realize that it's 7:45 already. Right, Texas Medicaid waivers, we talked about it a little bit already, where the money comes from, what they do in the community, which, just to repeat a little bit, is allow people who have special needs to take the funding that they would otherwise qualify for state-supported living centers and waive their access to that funding in order to use it in the community to use community-based services that allow them to live with their family members or in group homes or in facilities, larger facilities. But the different kinds of homes that people have access to depend on which kind of waiver that they have. We talked a little bit about service delivery options. So here's an array of services that people have access to with the Star Plus waiver. And so in addition to living arrangements, service access also changes based on Medicaid waiver program enrollment. So not all Medicaid waiver programs give folks access to supported employment, for instance. Home and community-based services does, CLAS does not, if I remember right. All of these services tend to intersect a bit, but depending on where somebody is in their life, CLAS might be a better option for them than HCS, or vice versa. Let's go here, right. So CLAS is an option that does give people access to living in intermediate care facilities, which are bigger facilities, right? You've got kind of like the family home or the group home, which is a group home where a person with IDD can live outside of their own home, and usually with just 2 or 3 other people. And then there's the intermediate care facility, or ICF, where people can live if it's better for them to be in bigger environments, right? Or have access to more immediate care, in which case there are nurses and doctors who live there too, or sorry, who work there full time too. So the helpful thing about this document is that it does also give you a sense of what kinds of populations each of these waivers works with. And so I'm not going to go through this whole document, except I'm just going to say it does exist. And if people are interested in checking it out, if they are curious to know what kinds of waivers are out there, this is a document that can be really helpful to learn those details. There's the deaf, blind, and multiple disabilities waiver also, specifically for people who do suffer from deafness or blindness and have multiple disabilities, right? Here's a different set of service arrays for those folks. Home and community-based services here. This is perhaps maybe like the most comprehensive waiver program. People do have to have an IQ of below 75, right? And across the, well, not across the board, I guess, generally Medicaid waiver enrollment is singular. So people cannot be enrolled in more than one Medicaid program. Now, I will say also, as we go back to this PowerPoint presentation, that when we get into respite care options for folks, there are some respite care options that allow people to maintain their status in their Medicaid care program and also get respite care through another program. So before we get there, though, I'm just going to stop and see if anyone has any questions. I'm going to very quickly go back to a Google document. Okay, so here we have one question. If I defer my son's name at the time he gets called from the list because he's too young, what happens? Will he go back to the end of the list, or can I ask for a space when his age comes? Thank you. That is an excellent question, and it does also depend on the kind of waiver. Home and community-based services will generally not keep somebody's name at the top of a list, but STAR will. So it depends on the access, or it depends on the kind of waiver that you want access to, and also those standards change. Unfortunately, like, because there are so many different kinds of waivers, and Health and Human Services is always making updates to waiver programs. There's no kind of like set standard across the board, but it is good to know, it is good to get familiar with those programs and to make sure that as soon as you get notification of your son's eligibility for a waiver program, that you're in touch with the folks at the local intellectual and developmental disability authority so that they can help you manage that process. Whether it might also be good to, if you're on multiple waiver lists, like maybe his name's going to come up on the next one before his availability would be on the one that he was already eligible for, but then he was too young. Which is just to say, like, maintain pretty constant contact with the LIDA so that you can make the most educated decisions possible. And then one more question. After age 18, can the adult getting the services be his own CDS employer? I am getting mixed responses on that, specifically for class. Can parents be the employee, since it is very hard to find caregivers? And again, like with lots of questions related to Medicaid waivers, it depends on what kind of waiver it is, because sometimes parents and loved ones with intellectual and disabilities can live in the same household if that person is going to get those waiver services, and sometimes they can't. And then depending on whether or not that loved one does live in the same household, then that determines whether they can become a caregiver too. And generally, a person with IDD, their eligibility to become an employer depends on their IQ and an assessment from their service coordinator. So if your loved one is already on a waiver program, then I would say get in touch with your service coordinator and make sure that you know, as soon as that child does turn 18, or if they already are, what the requirements are on that waiver for a person to be their own employer. And we'll have another Q&A session, at the end of this. So I want to get through this PowerPoint. I'm going to share my screen again. There we go. Okay, so respite options also vary at by authority level, right? At the level of the state, There is the Aging and Disability Resource Center, which right now is awaiting a new round of funding for their lifespan respite program. But I spoke with their staff this week, and they did confirm that it should be September when they get that new round of funding. So the lifespan respite program is a short-term respite program where people can hire non-family respite staff, right? So that's one of those specific instances where you cannot hire a family caregiver. But people can be family friends, or you can work with an agency who can provide that staffing for you. And they have an application process that is, I think it's fully online now. But their staff are really helpful. They're only 3 people large in that office, but they're all like really, really supportive in helping people find access to respite care. So it's unfortunate that right now their funding has run out, but they will get it back again in September, from what I heard from them over the phone. And then there's also the Community First Choice program. This is a state-funded program. So Medicaid waiver programs are federally funded, and the Community First Choice program is state funded. So that means that people can actually the double dip, which I'm not sure how I feel about that term either. But in any case, people can be on a waiver in order to and access Community First Choice respite care options or not. People do have to be eligible for Medicaid, but it doesn't matter whether or not they're on that respite care program. And the Community First Choice office is state funded, and they do have availability right now. And then there's also the option for immediate care facilities. And this is not a popular one because it does involve a loved one staying at a facility that is not in the home. And most people, when they think about respite services, want access to respite either in their home, so their loved one doesn't have to go anywhere, or out of the home for a program like a day habilitation program or something. But if situations do get dire, and I'm, not to be alarmist or anything, but if situations do get dire, then there are intermediate care facilities where a loved one can stay for a couple of days or a week, just until a family member or a whole family, if a family is experiencing stress, can reorganize their intentions and their experience, and maybe the way that they all live together with their family member with IDD, in order to provide a stable and welcoming place for the whole family to thrive together afterwards. So intermediate care facilities are available too, and you can contact also, again, the local, the LIDA, the Local Intellectual and Developmental Disability Authority, in order to access those programs. And then, and then there's the YES waiver too, which is in-home only right now and in Travis County. So they don't have any day hab programs, but as lots of people are realizing, the day hab programs have closed for now. And then there's also private pay, right? Public or private pay, and then informal groups. And these are, I really want to emphasize in this presentation, in the few minutes that we have left, informal respite option groups. I'm going to go through a couple of different mutual aid groups that people have access to, but at the beginning of this presentation, when I mentioned organize first and reach out second, these are intentional and invested and community-driven groups of people who might have a few extra hours a day to help people take a break from their loved ones with special needs. And they are informal though, so they do require reaching out to strangers. But that's okay, that's oftentimes a way that people are able to access new groups of supporters or groups of friends, right? By reaching out to people who they've never met before, or maybe who they've just met over a Zoom call or something. So those informal networks of neighbors, churches, community members, voting rights groups, work groups, softball teams, those can often be some of the most supportive informal methods that people have to find respite care, especially during a crisis when groups like the Aging and Disability Resource Center have already maxed out their funding. So I don't want people to discount those very important and oftentimes very effective groups that can be so helpful, even though they are informal and they do require a bit of innovative thinking. And we'll talk about different ways to access those groups also. And then this is just a list of respite organizations in the Central Texas area that I keep. People, I'm going to share this this presentation with folks after it's over. So you'll have all this. You're welcome to email me or the Autism Society, and you can get this info. The yellow highlighted options on this screen did confirm with me that they are taking new clients. And care.com is, you know, it's not an organization. It's just a place where you can reach out. And so I kind of categorize care.com as like formal, informal, because they do have a vetting process for people who are available as special needs helpers through that platform. But it's not an agency. You know, you can't go to it. They don't have programming. It's just you reaching out to an individual who has capacity and time and a skill set to benefit your family and your loved one with special needs. But the Central Texas Children's Center right now is not open for respite care, but they are opening in August. So we've just got like 2 weeks, almost less than 2 weeks until their program does start again. And that is, it's a free monthly respite program. They do 4 hours of childcare on a Saturday each month. And it's for, yeah, people can use that service once per month. So I know it doesn't seem like a lot, but that 1 4-hour chunk can like really be a difference when people are needing respite care, you know, for their loved one pretty significantly. And then these two at the very bottom that are in kind of like a paler yellow, Take Time Texas is actually, it's a search function on a website through Health and Human Services. You can get lots and lots of options for respite care there. And if you have time, you can call through them and see what their options are. That's partly how I've made this list, is by talking to people at different organizations, but also talking to folks who are available through that list at Take Time Texas. And then Training Wheels is a new ABA facility in South Austin. And I was just on the phone with one of their coordinators the other day who said that they're thinking about maybe potentially being interested in starting a respite program. So as I work through that process and talk to those folks, I'll of course update interested people in what their respite program looks like too. And caregiver support services, I'll go through this slide really quickly because I know we're kind of reaching the end time, and I'd like to be able to answer other questions too. But also everybody's going to have this information afterwards. So caregiver support services run the gamut from federal to state, as I mentioned earlier, right? Just the same way that tools for support do and tools for respite care do also. So at the level of the insurance company, at the level of your employers, check in and see with your employers about taking some family leave during really difficult times. Like, lots of employers recognize that this is an unprecedented crisis. And if you're able to take especially paid family time, it's worth it. And I know we're in Texas and that's not often the case, but employers are making arrangements with employees right now because everybody's struggling during this really difficult time. So that second point that I made at the beginning of this presentation, after organize, is reach out. Like, don't hesitate to reach out to your employers and just say, like, I think I need some support here. You know, I need some assistance. And then check in with your health insurance company too. I mentioned this earlier, but ask about telehealth options. For counseling, for behavioral health, for your loved one with special needs, you know, if that person can operate in front of screens, like even half an hour while a loved one is in a counseling session or in a therapy session can be really beneficial for somebody to just have half an hour to take a break, you know. And then of course there's also the support groups through the Texas Autism Society, Texas Parent to Parent. I've mentioned them a couple times. They are an amazing resource for helping people build personal networks, to do the organizing that allows people to really reveal to themselves the abundance that is in their communities and the different abundant resources that they have to help manage loved ones with special needs during this difficult time. And then, of course, the Caregiver Action Network also has a free caregiver help desk. That one does have time limits on it, so from 7 a.m. to 6 p.m. But then there's also Integral Care's 24-hour crisis hotline. If there's an emergency, do not hesitate to reach out. Again, like it's not often ideal, but if it will prevent a scenario from escalating into one that is more traumatic, it's best to just, you know, try and prevent those situations before they really take off, and before people start experiencing like great instability, you know. Right, so I made the announcement earlier about the ARC of Texas, so I'll skip that one. But also the Administration for Community Living they have a Family Caregiver Advisory Council, and they're actually paying family members $100 if they want to share their story. So for caregivers who have experience assisting an elderly family member, you can take part in one of their info sessions on July 28th, 29th, or 30th. And again, like I'll send all this info out. And for parents or family members who are supporting a young child or an adult child with special needs, there's an info session on August 5th and August 6th. If you have time and if you have inclination, you can take part in those info sessions where the Administration for Community Living is trying to learn about the experiences of family caregivers in order to direct programming for them moving forward, which again, like this is an organizing process that could lead to perhaps more future respite services and support services available to family caregivers in the future. And then there's just my two takeaways one more time. Organize your network. Before a pandemic, not like all crises or pandemics, but organize your network before a crisis if you can, and then never hesitate to reach out. It's always best to tap into the resources that you have in the community and even with people who you've never met before, right? And I'm gonna put my info here for contact info. What I didn't get a chance to get into in this presentation was mutual aid networks. Those are the intentional spaces that a lot of community organizers have built in the last 4 months during COVID, but also before that too, so that community members can really support one another during difficult times. And I am gonna just to get back to the Google Doc that we're sharing with questions. Okay, here's another question. Can a child be eligible for both the MDCP and HCS waiver programs? Eligibility, yeah, people could definitely be eligible for both programs, but they can't be in both programs at the same time, right? So those are two waiver lists that I would say get onto if your child does meet the criteria for both of those Medicaid waiver programs. But then as your child gets to the top of each list, right, I would say get on the program that they're eligible for first and that they get into first. And then if their name gets to the top of the second list later, and you realize that maybe that program, that Medicaid waiver program, is more appropriate for your child, then you can switch over. And again, service coordinators in the local intellectual and developmental disability authority can help you do that. And while we're writing out this next question, I just want to share my screen one more time. This is my web browser. And this is an example of a mutual aid network here in the Austin area. It's called CareWeb Austin. And this is a spreadsheet that is available online, which I can absolutely share with folks. And it has lists of people who have skill sets in all different kinds of arenas, like people who are available for transportation or emotional support, right? Somebody who's available for cleaning or childcare. This person's available for transportation or errands. These are all informal networks of people who have skill sets and are invested in caring about their community. So, and if you did want to reach out to any of these folks to see if they maybe have a couple of hours, maybe even for no pay, they do have modes of contact here in this same spreadsheet. And like I mentioned earlier, it would require reaching out to a stranger, and this is an informal network, but these are the types of community building organizations that exist right now to help people who are in unprecedented circumstances. And I know we keep saying that, but these are the times when it's good to be innovative in our thinking and intentional in our organizing of our loved ones' care networks, so that people do have access to multiple kinds of resources when offices don't have funding available again until September, or when your regular caretaker maybe, you know, has gotten sick or something, you know, like all of these things are happening right now, and they're really, really hard to deal with. So I want to mention CareWeb Austin, and then there's also Austin Mutual Aid, which is another group that that has a really lively and robust Slack channel. If anyone has ever used Slack before, it's a project-based text messaging app that allows people to reach out to other community members who are also invested in sharing innovative ways to build and maintain communities during difficult times. Or you can use their Facebook group too. They do have one of those. So CareWeb Austin and Austin Mutual Aid are good places to find folks who are interested in helping community members get through difficult times. And if you have any questions about, you know, how to vet people, how to even reach out to somebody who you've never met before, sometimes it can be good to text message them first and then give them a call later. You know, there's all kinds of different strategies. It just depends on what your style is, and how you'd like to go ahead, kind of, you know, pursuing a kind of unconventional option during a difficult time. And now I'm going to stop sharing my screen for the last time and go back to questions. One, okay. Where can you find IDD coordinator contacts? So service coordinators are available through your local intellectual and developmental disability authority. And in order to find that, you go to the HHS website or just Google HHS LIDDA, that's LIDDA. And you put your address, or sorry, I think it's just maybe your zip code, into that website, and the website will generate for you the local local intellectual and developmental disability authority in your area. So that's how you can find those service coordinators and get on those waiver lists, and follow up on those waiver lists. It can always be really helpful for families to just know where they stand, because, you know, 12 years seems like 12 years is a long time. And one more question. We have a federal action alert in the comments to add funding for HCBS and special ed in the next COVID relief package. Awesome. That sounds like somebody from the ARC of Texas. I haven't checked the Facebook yet, but I will. Okay. Let's give it a few more minutes. I will put my contact info back up on the screen so that people have access to it. And then we'll just hang out for a couple minutes and see if anybody else has any questions. I'm trying to think of also some stuff that people who have reached out to me recently. I've gotten some questions recently about how to find a healthcare therapist who is working in teletherapy. And so, you know, depending on what kind of program what kind of program somebody is in, whether or not they also have access to a health insurance company that has a provider directory. There are lots and lots of mental health care providers who are operating by telehealth right now. And so those, like I mentioned, can be really good ways to even just find, you know, half an hour or 45 minutes in a different room, or even in the same room, but across or separated, or just, you know, doing something different. The real plethora of telehealth that's available right now has been talked about for a long time in behavioral health circles, and then just to see the communities respond so quickly due to COVID has been really inspiring. And I hope I hope some folks are able to take advantage of those to get a quick break here and there when it's available. Do we have any more questions? Okay. Well, I want to thank everybody so much for being here. I know that we didn't have as long a Q&A as I would have liked. I ended up, well, I like to talk. But you do have my contact info. If anybody has questions, I'm going to, I'll be, I check my email regularly. I answer my phone regularly. I'd love to just be a resource to folks if they need one. I will also send out these slides, and along with the slides, I'll send the spreadsheet that I keep that has respite care options on it, and also a link to the respite care finding website that's available through Health and Human Services called Take Time Texas. And yeah, I think that folks reaching out to aging and disability resource centers and community first choice in the coming days is going to be necessary. And I can't advocate enough that people do remember that this is a difficult time that calls for kind of creative responses to problem solving. So I think that there are lots of really good folks out there who might be just a click or a phone call away, since some of the traditional methods for respite care like day hab and such are obviously not available right now. Like I said, please don't hesitate to reach out to me. I really appreciate your sitting in on this Brown Bag Lecture Series. And thanks again to the Texas Autism Society for hosting it. I wish everyone good health and lots of hand washing.
Okay, I ended that, and I'm going to end the recording.
Okay.
Okay, that was great.
Yeah, okay.